Hi, my name is Miriam Naiman, a senior advisor in the Post-Aliyah Answers and Advocacy Department. Today, we're going to discuss navigating the healthcare system, a topic that I'm so passionate about because as you continue or perhaps begin with your Aliyah planning, understanding how your healthcare needs will be met in Israel is of utmost importance both to you and to us, so that by the time you arrive, you can feel secure in knowing how and where your own personal medical needs for yourself, for your family, will be met in Israel. Let's begin. As you see here, are listed the four Kupot Cholim, the four healthcare providers available in Israel. These healthcare providers are available within multiple clinics depending on where you are moving to. For example, in some cities, you will see multiple clinics of Maccabi and Meuchedet, and in other cities, you may see only Klalit or only Leumit. Your choice of Kupat Cholim will then also be paired together within the city that you have decided to move to in Israel. As you see, these logos are listed below the logo of the National Insurance Institute, the Bituach Leumi. Why is that? That is because there is no separation between the relationship of the National Insurance Institute and the Kupat Cholim system, the healthcare provider system, because these are the providers of care, and it is the Bituach Leumi that enables you to have the opportunity to be part of the healthcare system from the moment you arrive, regardless of your age, regardless of any pre-existing conditions. By law, every citizen of the country has healthcare in Israel. For those of you who will make Aliyah with an Oleh Chadash status, you were not born to an Israeli parent abroad, you were not born in Israel and left before the age of 18, and you were not a temporary resident at some point in your past, you will have eligibility to join any of these Kupat Cholim and be covered by the Kupat Cholim system from the moment you arrive. This is one of the forms you will sign on at the airport. For those of you with a previous ID number, with a previous Mispar Zehut, if you were born to that Israeli parent abroad, or if you were born in Israel and left before the age of 14, you too may be eligible right at the airport to get your health care registered. If you were a previous A1, if you were a temporary resident in the past, it is very important that you discuss with your Aliyah advisor how and when you will be registered for the healthcare system in Israel, because it will not be automatic. You will have a waiting period, and this is something very important for you to understand prior to arriving on your Aliyah flight. As we've discussed, we cannot continue to talk about the healthcare system in Israel without really understanding the role of the Bituach Leumi and the healthcare system in Israel. The Bituach Leumi, the National Insurance Institute, is responsible for all of the different social programs in Israel, for which healthcare is one of those social programs, as is disability and different benefits for having children in Israel, and unemployment and long-term care, and even burial till 120. I encourage all of you, over a good cup of coffee, have a look at the Bituach Leumi website wherever you are sitting today. That website is btl.gov.il. At the top left, you'll see the ability to translate it into English, into French, whatever, and to Spanish even, whatever language suits you. Have a look at the different categories, because as you will see, the Bituach Leumi carries a resident in Israel from birth till death. The Bituach Leumi offers all Olim a benefit of not paying into the Bituach Leumi, of not paying any contribution for the healthcare contribution for the first 6 months. That's why when you read over your rights and benefits as Olim Chadashim and you see free healthcare for the first 6 months in Israel for those who are unemployed, that's what this means. It means that the Bituach Leumi is granting you this particular benefit. After the 6-month mark, everyone will be responsible for paying a healthcare contribution. Who will not be responsible for paying a healthcare contribution? A small portion of the population, whether it's a housewife in Israel is someone under the age of retirement, or someone who is having their national service doing Shirut Leumi, or they are actively in the army. I've listed here who is considered a senior citizen in Israel. This is something that people are very, very concerned about because many things in the Bituach Leumi are determined by age or population. For a man, the age of retirement, regardless if you're working or not, but the age of retirement is 67 for a man. For a woman, this is between 62 and 65, depending on your birth date. How can you find out? On that Bituach Leumi website that I mentioned, there is a chart that lists from year to year where you can find your age of retirement. As you see here, the last line talks about residency. Over the past few years, residency has become a hot topic. Perhaps you know of friends in Israel or family who have made Aliyah, and this is something of concern to them. That is because when you make Aliyah, you become a citizen, and that citizenship will never be taken away from you. I am a U.S. citizen. I have not lived in the United States for 30 years, but I will never lose that citizenship. So too, when you make Aliyah, you will always be an Israeli citizen. However, residency is based on your center of life. Where are you a resident? Where do you live? Physically, not only your heart is in Jerusalem, or that you've owned that home for the past 20 years, or that you have a tourist bank account, but rather, yes, where do you have that home? Where do you have that bank account? But where is your physical self? There is no number per se that I can give you because the Bituach Leumi has begun very seriously to put the residency of Olim Chadashim under a magnifying glass. It is their understanding that when you make Aliyah, you've come here to live, to settle, to be a resident. Now, of course, that's what you're thinking, because that's why you've gone through all that paperwork and you've gone through all of the planning that you're working so hard to do to ensure that your Aliyah is a successful one for yourself, for your family, whoever is making Aliyah with you. But really, where is your center of life? Will you be traveling back and forth because you're still maintaining a business abroad? Will you be traveling back and forth because you're leaving elderly parents? Will you be traveling back and forth because really you're leaving children behind? Because you like to vacation and now you're taking the opportunity to move to Israel as a springboard to visit Europe, to do whatever you want to do? That's fine. But where is your center of life? Where are you spending the majority of your time? If this is a concern to you, then please discuss with your Aliyah advisor. Once you have one, you will have an Aliyah advisor within 12 months of your Aliyah. And if you know already that you'll be maintaining your lifestyle, whatever that lifestyle is, it may be having your summer home in one country and your winter home in another, whoever you are, because we're all individuals, and your aliyah planning is individual to you. And one of my goals today is to make sure that you understand from an individual perspective how your residency and your health care will work for you once you make aliyah. So what are your concerns? We spend a lot of time on Bituach Leumi because, again, there is no separation between the Bituach Leumi and providing your health care. Because should you lose that residency that I just discussed, you will also lose your health care. You will not only lose your health care, but you will lose all of the different areas of your life that Bituach Leumi touches. So, for example, if you're getting a child allotment, as all Israelis get money for having children until those children are the age of 18, if you lose your residency, you will stop getting that money. If you are getting certain pensions and you're out of the country for too long, you may need to reapply for some of those pensions. If, again, I can't encourage you enough that if these are concerns of yours, please discuss them off the bat with your Aliyah advisor and be proactive. Your Aliyah advisor is going to ask you a lot of questions, but you know those questions that are important to you. And that brings us to your concerns when we discuss healthcare, because everybody has them. For please God, all of you who are in the best of good health, to those of you who are looking ahead to knowing that you're going to have children, to knowing that, please God, till 120, you may need to see the doctor once in a while. So these are some of the things that we are going to discuss today. Map out those concerns. I always tell people to get an Aliyah notebook and divide it into different sections. Your healthcare needs should certainly be at the top of one of those sections. The healthcare system, as I mentioned, is a universal system. Everyone in Israel, all citizens and all residents, are entitled to be part of the healthcare system, regardless of age, regardless of any pre-existing conditions, which is amazing. As I mentioned, your registration will be influenced by your Aliyah status. As I talked about the Oleh Chadash, I talked about the person who is making Aliyah already having an ID number, and I spoke about the person who was a temporary resident in the past. These are three major statuses in which will be discussed with you, with your Aliyah advisor, understanding how, where, and when you will be registered for the healthcare system. If you are eligible for healthcare immediately, that means your coverage is available immediately. Don't trip on your way to luggage from the airport after you sign on your health care in the airport. But God forbid, if something should happen to you, even within the confines of the airport, you would already be covered. I know in many countries, when one approaches a hospital, you must be able to provide an insurance card. Not so here in Israel. All you need to provide is the name of your Kupat Cholim. And if you are eligible for coverage immediately, that means that, God forbid, even before you had that membership card, and if you had to go seek out emergency care, you could say, oh, I'm part of Klalit, I'm part of Leumit, I'm part of Meuchedet, I'm part of Maccabi, whichever one provider you are choosing. And then, God forbid, should you need to be seen in an emergency room, you would be able to be seen. So how can you choose? There are four. When you move to the bigger cities, you will find all four available. If you're moving to a smaller city, if you're moving to the north or the south, a yishuv somewhere, you may find that you are more limited in your choices, and that's fine depending on your needs and depending on your choice of community. I often encourage people to think about what their present medical needs are, and you know what those are. And that may dictate your choice of Kupat Cholim. It may even then dictate your choice of community or how you want to facilitate and manage that choice within the choices given in your said community. But that choice is yours. How can you choose? I'm moving to Jerusalem. I can choose any, and I just don't know. Well, networking. Networking in the 21st century couldn't be easier. It doesn't matter who you are or how old you are. You can network with Facebook. You can network with a WhatsApp group within your community. You can network within an email chat. You can pick up the phone to your Aliyah advisor and say, I'm moving to Baka. I just don't know anyone in Baka. How can I choose a Kupat Cholim? I'm 55 years old and I just don't know what to do. There are many barriers that one feels when they're planning their Aliyah and even after their Aliyah. But with each barrier is so often a parallel resolve, a parallel solution, so that that barrier can quickly be knocked down and you can have a solution that works for you. I certainly understand that the solution for one person is not necessarily the solution for the next person. And that's why we try so hard to make your Aliyah planning and your Aliyah experience yours. Choose a doctor that speaks your language. You might be fluent in Hebrew, but you really want a doctor that speaks English. How are you going to choose a doctor? Again, you're going to go back to networking within your community. You may already know that you're making Aliyah with certain specialty needs, pediatric needs, whoever you are. Network, network, network. Of course, you want to be careful when you network. You want to be able to protect your own privacy. But when you say general questions like, I'm making Aliyah, I'm a particular age group, or my children have particular needs, can somebody share their experiences? If you say which kupa is best, which provider is best, that's a very broad and general question. The more that you can sort of scale down what you're looking for will help you get the information that you want. We also have amazing connections with liaisons of all four kupot cholim. And so, if you know that you take a particular medication in an unusual compound, perhaps you take a patch and not a pill. If you know that your child has a particular need, whatever it may be, let your Aliyah advisor know so that they can connect you with the liaison of the kupat cholim that you may be choosing. And now perhaps you're not sure. You may be wanting to compare. There is a wonderful website where one can compare the different options and services within each Kupat Cholim. However, unfortunately, due to security situations, it is not available abroad. I will mention it here anyway. It is call.gov.il. This is a site all in Hebrew. It can look very overwhelming. Use any of your translating tools that you may have on your computer to look at this and understand, just to get a little bit of a taste. And the fact that it's all in Hebrew is an introduction to the fact that while your doctor may speak English and perhaps other therapists in your life may speak English, the front desk secretary may not speak English. And although there are all of the Hebrew websites, all of the websites for the Kupot Cholim have an English tab to them, they're really not very good in English, all of them. They give very, very surface. In the Hebrew, that word is shitchi. They just give the top points of the Kupat Cholim without giving that nitty-gritty, which is what you're looking for. And so you will want to look at those Hebrew sites in Hebrew to get a better understanding of what your Kupat Cholim has to offer you. On the post-Aliyah side of life, we have so many different services that are going to assist you in understanding how to navigate almost anything in Hebrew. Let's say you choose that doctor that everybody says is amazing. And so you're choosing amazing and you get to that doctor and you're like, he's not very amazing for me. That's not a reason to change your Kupat Cholim. It's a reason to change your doctor. I encourage everyone to make appointments soon after their arrival when they're not feeling vulnerable because they're sick, when they're not feeling stress, but rather at a time to say, hi, I'm new. I just moved here. I would like to be your patient. And you get a feel for what that person is like. Switching doctors is not that big of a deal. People do it all the time. What's good for one person is not good for another person. Don't just say, well, this is my doctor and I guess I'm stuck with. Always ask questions. Always be proactive. As a new immigrant, it's sometimes hard to do. But call us post-Aliyah and we're going to be so happy to answer those questions. Switching your Kupat Cholim is a different story. You may make Aliyah based on whatever decisions you have, and then said to yourself, you know what? I chose this kupa, but I think that that kupa is going to be better for me. Then you're going to switch. If you make Aliyah and decide that you want to switch within 14 days, you can do so without any time lapse whatsoever, and we will help you do that in the post-Aliyah department. If 14 days have passed, you will follow the directive of all Israelis. It's a quarterly opportunity where you can switch your Kupat Cholim. If you decide to switch your Kupat Cholim, you're going to switch at the level that you are coming from. I told you that we were going to be discussing supplemental insurance, and that is something we're going to be discussing shortly. And certainly when it comes to child development, maternity needs, they are not all the same. And you want to understand who is going to be the best provider for your needs. As I mentioned, when you get to the airport and sign on your health care, you are signing for the basic level of care. And now you've come to your community. And a couple days after arrival, as you will be directed from the post-Aliyah department, you are going to go and complete your healthcare registration at the local clinic. The clinic setting is where all medical needs are filled, not in a hospital setting. You're going to go and give in the appropriate paperwork, and you will walk out with a membership card, sort of looks like a credit card, for each member of your family. You may be asked, or you will be proactive to ask, about supplemental insurance. There are 2 tiers of supplemental insurance that each Kupat Cholim has to offer you. For the sake of today's presentation, we're going to call it Tier 1 and Tier 2. Tier 1 for all Kupot Cholim, again, your age and pre-existing conditions do not influence your ability at all to be part of either supplemental level. What does influence is the cost and your age. And so a person who is in their 20s may pay 10 or 20 shekel a month, and a person who's in their 70s may pay 130 shekel a month. And again, I want to really drive home the fact that age and pre-existing conditions do not influence your ability to be part of the highest level of supplemental care. You know, I often cite the story of an Ole that I had the honor of assisting. He was 102 years old, and he too, no joke, joined the highest level of supplemental care. So what is Tier 1 of the supplemental care level? This is going to broaden the basket of medical services that the Ministry of Health has to offer. So the Ministry of Health sort of gives a basket and states these are the services, these are the medications offered within the basic basket of services for physical health in Israel. This will also include mental health services. That means if you need surgery, it's covered. It means that if you need any of the hundreds, probably thousands, of medications offered within the basic basket of care, those are yours, whatever you may need. However, when you have the supplemental level, it broadens that basket beyond the basic basket of services offered. It also allows you, regardless of which Kupat Cholim you have on the Tier 1 supplemental level, to have personal choices of that surgeon, to get personal second opinion from private doctors as long as they are recognized from your Kupat Cholim. That means, for example, the doctor says, you know what, I'm concerned about X, and you want to get a second opinion. And so you will look to see a specialist in that field. That specialist may be seen in a hospital where you will use a service called Sharap. Sharap stands for Sherut Refu'i Prati. And this is a level of service where you will see a specialist on a more privatized level. This will be of cost to you somewhere between 250 and 350 shekel that you will pay. And you can use this service several times a year, depending on which Kupat Cholim you have, will determine how many times per year, per person in your family, you can use that particular service. We encourage everyone, because over 80% of the Israeli population has minimally the first tier of supplemental care. The second tier of supplemental care broadens lifestyle benefits. The first tier also does cover vision and optical, and also may cover specific things for children. The second tier will broaden what the first tier offers in terms of optical, in terms of dental, in terms of certain services for children or for having children. For example, when you have the higher level of supplemental care, it may offer you a larger maternity basket to cover a specific needs, such as getting a doula or needs for the baby, like a car seat. These are things for you to research when your Kupat Cholim of choice. Not sure how to research that? Ask us so that we can remind you and we can connect you with others. There is also a long-term care benefit offered within the Kupat Cholim system. This benefit is determined by age and pre-existing condition because it is a private policy with any one of the different insurance agencies in the country. What this will offer you is 5 years of long-term care as determined by criteria that you need to meet to get that long-term care. This is going to be offered to you on a privatized level that you will pay a monthly premium for, just like you may already do abroad. It gives you 5 years of care and not 5 years in a day. But should you decide not to get this long-term care benefit through your Kupat Cholim, or you may not be eligible, there is something called Kol Zchut. This is a long-term care regulation from the Bituach Leumit that says everyone is entitled to long-term care. It may be influenced by your income, not how much money you have in the bank, by your income. Because whereas over 80% of the Israeli population has minimally that first tier of supplemental care, not everybody has a long-term care benefit through their Kupat Cholim. There is so much to know on how to navigate your Kupat Cholim, whether that is any type of medication, whether that is how your needs will be met. What should you do if you have an emergency during the middle of the day or in the middle of the night? That is not the purpose of this particular presentation today, but post Aliyah, we have many presentations on the ins and outs of navigating, now that you will be here, on navigating the Israeli healthcare system. Some of you may be asking, should I keep my foreign insurance? I will be traveling back and forth. Or I'm not ready to cut that cord, because it is a hard cord to cut. You know, when you move to a new country, you may find that you spend 5 shekel more on a product in the store before you learn that you should have gone to the other store to do your grocery shopping. And there's that like sort of wiggle room of a learning curve. When it comes to your health care, that's not where you want to wiggle, and that's not where you want to have a learning curve. You want to feel secure the moment that you get off the plane. For many of you, you may not want to cancel your foreign health care prior to your Aliyah. This is a personal decision. However, just to make note, whereas you may have used your foreign health care when you are on vacation in Israel, as a citizen, you will no longer have that opportunity. Some of you may want to know about private healthcare insurance in Israel. There is private healthcare insurance in Israel. This will cover you for a lot of other things that the Kupat Cholim may be not as smooth sailing, we'll call it. For example, if somebody were to need, God forbid, a transplant or some sort of very serious operation abroad and the like. This, again, is something for you to research. Is this something I need? Is this something I want? It's an insurance policy. And we all like to feel secure. And so you can go to any one of the insurance agents and ask those questions or look at their websites, because it is an insurance agent, just like an insurance agent is going to give you home insurance or car insurance. He too or she too can offer you private healthcare insurance where your age and pre-existing conditions will be taken into account. We talked about how to research those medical needs, whether it's with one of our liaisons. Now, one of our liaisons is not there to answer, well, which one is best for me? Because you're also not going to write to all 4 of them at the same time. But what you can ask is, this is my medication. It's an unusual medication. Will it be available based on my need? Because although a medication may be available in Israel, it also might need to be specific for your need. We know that there are several medications that have multiple uses. For example, something may be good for arthritis and something may be good for depression. Same medication. What is your need? Of course, if you're coming with a regimen, you're already coming with a history. That history is going to be respected and taken into account, which is why it is so important that you bring a summary, not a Megillah, a summary of your medical needs, where you've been, where you are, and where your present doctor or your present specialist sees you going. Most important is if your doctor has tried a variety of medications and now has settled on the medication that has worked for you. It could be very, very important here for that to be stated by that medical professional, because here in Israel, the Kupat Cholim system may say, we are going to provide financial participation, because the system here is a financial participation system. It is not a free system. It is a financial participation system that we are only going to cover your medication after you've tried medications A and B. And you may say, but I'm already at medication C. You will need the medical proof so that your doctor in Israel can already apply you for the proper medication. You need quarterly imaging, you need yearly imaging because of your past, not a problem. The Kupot Cholin, even on the basic level of care, are going to cover all pre-cancer imaging, testing, because that is part of being healthy. And Israel likes its residents and citizens to be healthy. Whereas the basic level of care for your first 6 months is going to be free, the supplemental tiers are not free. I mentioned earlier a range of costs that are going to be dependent on your age group. You may say, well, you know what? I have worldwide care because I have an amazing pension. And so you may decide that you would like to import your medication. There may be no need for you to travel out of the country every 2 months to get a refill, but rather to import. And there is a mechanism for you to do this legally, as long as it is not cannabis-based. Cannabis-based medications, by law, cannot be imported into the country. Should you be a patient that is using any form of cannabis for your medical needs, make sure to mention this to your Aliyah advisor. We also have a great article on how to access cannabis medical care on our website. Understand availability and eligibility because they may not always be the same. There's no waiting period for you to get your medication, but we want to make sure that you feel secure on how you're going to get your medication. And by the way, when you're going to go to finish up that healthcare registration, this is going to be one of those questions when you go and you get your card. So, is there a pharmacy, a particular pharmacy that I need to go to? What do I do in the middle of the day if the clinic is closed? What do I do if I have an emergency? Be proactive. And these questions might stay in your pre-Aliyah notebook to carry over to a post-Aliyah notebook, because making Aliyah is very exciting and being an immigrant is harder. It takes time and patience, and you may get frustrated. And as I mentioned earlier when I introduced myself, I'm a senior advisor in the Answers and Advocacy Department. That is our post-Aliyah department. And we're here to minimize that frustration and help you get to the solutions that you need. Mental health can take a licking. It can find you in your darkest moments that, oh no, what did I do? Was I crazy? I thought this was going to happen, and now that happened. And all of a sudden you find yourself stressed. And all of a sudden you find your Aliyah as a trigger to something from your past. Or you know what? You just need someone to talk to, because perhaps you're making Aliyah on your own, whether you're 18 or 118, and that's okay because you've lived alone, but nobody wants to feel alone. And that can put you in a bit of a darker place that you may want to be. Seek out that help. There are so many different resources in which one can get that help, whether that is through your Kupat Cholim, a private resource, a subsidized resource within your community. There are so many places to turn. Don't disregard the feelings that you are having. There's too much at stake, and that too much at stake is you. And we're so excited that you have taken the time now to explore what Aliyah means to you and how your healthcare needs will be met in Israel. It's hard to navigate a new system. Healthcare is just one of them. There's the banking system. There is your children's educational system. There is understanding food groups. And you are allergic to this, but you can have things that may contain, and what are those words in Hebrew? Because, yes, there's a lot of English no matter where you're moving to, but also Hebrew really is the language spoken. We have some vocabulary sheets on our website. If you put in healthcare terms, you'll find vocabulary for the healthcare system. You'll find vocabulary for supermarket terms as well, by the way. Case management works differently. Many times abroad, no matter where you're listening from today, your family doctor may end up being the case manager for your endocrinologist and your cardiologist and your child's needs, whatever those needs may be. Here, you will become more of your own case manager. And if gathering those certificates and apostilles wasn't hard enough, you may already know that managing a person's healthcare needs or special needs takes a lot of time and a lot of energy. Do you need help? Let us know. You may want to be connected with a private healthcare consultant who can be that arm for you, who helps you manage all of the different aspects until you are feeling more comfortable. Perhaps you have needs that you would like to be met at home. Is that a possibility? Because you are 100 and you can't just run out to get the blood test. How can that be managed in your home? We touched a little bit upon emergency care and urgent care, that this is something that you're going to ask when you go to finalize your registration. How can I meet those needs? Will I meet those needs at an urgent care center, such as Terem? Or does my Kupat Cholim offer urgent care hours late at night? Should I go straight to the emergency room because my stomach hurts in the middle of the night? No, you should not, because the emergency room in Israel is not a clinic. It is there for emergency needs. Of course, God forbid you think you're having a heart attack, you will want to rush to the emergency room, whether that's calling the ambulance service or Hatzalah services, but you will want to go right away. But you may, if you're not sure if you are having a healthcare emergency, you will want to call your provider's call center, available 24 hours a day, 7 days a week, to say, you know what, I have a very high fever. This is my situation. What should I do? If they decide that you should go to the hospital, they will send a referral ahead of you so that the emergency room already knows that you are planning to arrive. And it also means that the Kupat Cholim is going to cover that need, even if you're released 5 hours later, because when you go to an emergency room, time stops. And that's why we have so many urgent care centers in the country, because a person may just need stitches or may have broken something, which may not necessitate an emergency room need. It can be challenging to manage the language barrier. Find the resources that can help you best so that you can feel secure. Is it overwhelming? No matter where you're living today, if God forbid you were met with a new healthcare crisis, that too is overwhelming. You need to learn a whole new lingo, a whole new language. You need to learn who are your resources, who are your supports within that new medical journey. When you add that layer of being a new immigrant and Oleh Chadash, yes, that's very overwhelming, and that can happen. And that is when I hope you will turn to us. There are many points to ponder in that Aliyah notebook that you will purchase for yourself. It's not called an Aliyah notebook, it's any spiral notebook that you have, but have it so that you can jot down your questions, your concerns, a checklist, whatever is important to you. Is somebody in my family suffering from a disability? Perhaps I'm coming with someone with Parkinson's. Perhaps I'm coming with someone with Down syndrome. Perhaps I'm coming with someone, not a disability, but a child who needs PT, OT, speech. How will these things be managed? What information should I not take for granted, but rather should I research before I get on that plane so that I can feel secure? Getting a handicap tag in Israel is not difficult, but one has to have the proofs from their medical doctor on why they are applying for this handicap tag. Know that the time that you spend with your doctor is going to be considerably less. It may be much more directed, so that when you go to the family doctor, because you have, as an adult, you might have strep, your throat is hurting you, know that the doctor may not also listen to your heart and take your blood pressure and do all of those other things. It may be significantly more directed. If you suffer from high blood pressure and you're an adult, you can always walk into the nurse and say, hi, you know what? I'm just looking for a marker. Can you please check my blood pressure? Some of you may want to get all of your imaging or blood tests done just before you leave so that you can present a doctor with something present. And while that's very important, for the Hebrew word is hashra'ah, for comparison, Your new doctor may want to take his own tests so that he feels that he is responsible and he now owns that information, and it is not based on foreign imaging or foreign blood testing. What about durable power of attorney? Do I need to consider I'm coming with somebody who's older and frail? Do I need to consider getting any kind of healthcare proxy? Again, these are just points to ponder, not something that is going to be discussed here. However, there are YouTube videos that Nefesh B'Nefesh has done on these concepts. When things are different, they seem wrong. I can't believe I can't see the doctor at 2 in the afternoon. I can't believe that the pharmacy closes at 11:30 on a Friday in the dead of winter when Shabbat is early, because I do not keep Shabbat and I'm not even living necessarily in a religious city or in a city with a lot of religious people. And yet, because Friday is like our Sunday, that Kupat Cholim pharmacy may close at 11:30 or 12 o'clock. And lots of things that you will find yourself saying, I can't believe. I can't believe that I can't get my bills in English. There are so many English speakers. But those bills will come in Hebrew. Instead of saying, I can't believe, perhaps consider changing that lexicon to say, I wonder how I can find a resource that can help me understand. Because there are those resources that will help you understand. Don't just pay the bottom line at the bill. Don't just take what a doctor tells you as a given if it seems wrong to you. Or if your previous doctor back at home had once said this and now a new doctor is saying that. Challenge the doctor. Or perhaps that doctor isn't the right doctor for you. What are your next steps? Plan, plan, plan. Your Aliyah advisor is going to ask you a lot of questions, but count on you to ask him or her those questions that are important to you. Be proactive. Plan. How are you going to network with other people? You don't know anybody in Zichron Yaakov, but that seems like a really nice place for you to settle. On our website, we have community contacts, and you can write to any one of those individuals to say, hi, this is me. What are the popular Kupot Cholim in your town? Or you might see that in a particular town, there are volunteers of different age groups. Write to the age group that's appropriate for you. And what if you need to reset your expectations? Well, in general, expectations are one of those things that should be at the bottom of your suitcase. In your hand luggage, along with all of your documents, should be your sense of humor, a little bit of flexibility, a lot of understanding that things take time. And so you may need to reset that assumption that, of course, my blood pressure medication is available in Israel because everybody takes blood pressure medication. But what if it's not your blood pressure medication? What if it's a different milligram or a different compound? There is a wonderful drug registry offered by the state of Israel where you can check your medication in English. Now, it may be hard for you to understand how it's listed there, if it's covered in the basket of medications, if it's not. But you can even just Google today the Israel Drug Registry, and you will be able to put in English either the name of your medication or it may need to be the generic name of your medication. I and the rest of the entire Nefesh B'Nefesh family look forward to welcoming you home. Whether that is in summer of 2025 or whenever that is the best time for you, we can't wait. And we look forward to hearing from you with all of your questions. I wish you a great day.